about occipital headache. So occipital headache is two reasons. Either muscle tension headache, so this muscle is tight, so you get headache, or you have a cold, common cold or flu. So first, let's talk about this. So several channels travels from the back through neck to the head. So one channel is this channel, Du channel. Du channel is a central channel, one of the most important channel in the human body. It starts from the around your anus and it go all the way up, past your top of the head, and past your third eye, and it comes here. This is the end point, and you may remember the story a few years ago. Chinese doctor, he was Chinese and he was also a doctor of the Chinese medicine, and he happened to be in the airplane, and there's a patient who just had a seizure attack or epilepsy attack, and then he treated with a plastic spoon and toothpicks, so that he used the spoon to open the mouth, so the person won't bite his tongue or mouth around, and then he stimulated this point where the Du channel, at the end of the Du channel, he stimulated with the toothpicks, so to regain his conscious. Pretty neat story. Anyway, so this channel is on the head, and then side of the Du channel, this light blue channel, that's urinary bladder channel. That channel starts from the this side, inner Kansas, corner of the eye, and all the way up. It actually starts here, all the way to the back, goes through the neck, go all the way to the back, and come back up to the kind of corner of the shoulder blade, and descend again, all the way to the leg, and at the corner of the pinky. So this is a long channel. So if any of the back treatment, like a backache, lower backache, I use this channel. But if this is tight, this can get tight. Or this tight, this is tight, this can get tight, because channel is connected. So anywhere the disturbance of the chi movement easily can affect the chi flow in your head. And green channel, that's your gallbladder channel. Gallbladder channel starts at the corner of the eye, the other side of the corner of the eye, and then it goes around the side of the head, come back up to the around here, and go back again. And this one goes top of the shoulder. So this very, like, a lot of people have a knot here. So this channel goes through the around the mastoid process, and then go down to side of the body, and goes to the it runs the side of the body, and then runs the side of the leg. It actually runs the sciatic lines actually, but anyway, so this is the I often use to treat the headache, especially side headache. Side headache because well, I'll talk about later, but so this can cause the headache here. Well, this around here, like people say stress is on my shoulder, and then stress is stress can easily affect liver channel. Liver deal with your stress. And then liver and gallbladder is a sister bladder channel. So if there's too much stress that your liver can handle, gallbladder will be affected, and it will cause the chi disturbance. That's the one reason why the stress can cause the headaches or heaviness around this area. And the pink channel, the purple pink channel, is your small intestine channel. It actually starts from the side of the pinky finger, goes to the outer side of the arms, and wiggle around your armpit, and go on top of the scapula. So this is a very where's my scapula? So very sore spot for many people, and then come all the way to the neck, and then come in front of the ear. So if you, because you don't move, because you do this all the time, and then you don't move your shoulder blade enough, then a small intestine channel can be easily stagnate and then cause your headache or neck ache, which cause headache. So treatment principle is easy. Disperse the chi stagnation. So chi stagnation, if it's here, then I will use the channel, I will use the points on the maybe arms or other parts of the body to eliminate the traffic jam of the flow, and then it can help to treat the headaches. Exercise, Qigong exercise, acupuncture, cupping. You've seen like a cupping marks, like Olympic athletes is having like a circle mark on their body, like swimmers having a circle bodies. So those are the cupping. It can help to relieve the muscle tension. When it's severe, Chinese herbs will help. A cold in the head cold. You know, your regular common cold. So back of the head, because it enters, this is where the wind enters. So when you have a common cold, this area gets painful, and the whole head can get painful. When you have a cold, also you do get the dampness type of the head, aside from the nape and then back of the neck headache, because most of the Canadians have dampness accumulation in stomach. So cold, when you have a cold, you can have both back headache and a frontal headache, like a sinus congestion type of headache. Treatment principle is release the exterior. Release, when I say release exterior, means release exterior pathogens. So this is, you can think a cold virus. And they need to be released from the sweat pores through the, by promoting a slight sweating, not the drenched sweating, slight sweating. So for that, a Qigong exercise, acupuncture, and Chinese herbs will help. How to avoid this type of headache is not too hard. How to, because the issue is the traffic jam of the flow, it's not flowing. You just need to make the flow happen. So the small, some minor casual exercise is important. You can go for a walk. You can go for a walk in actually wood. The forest will be the best, because, like I said, stress can consume your liver channel and gallbladder channel, and both liver and gallbladder organs are under the 5 elements of wood. So going to the wood, going to the bush, going to the forest, and then have a short walk or nice good walk is really good for your chi circulation overall, and it will help for the headache. And it will help for the stress too. Qigong, I always say Qigong and yoga is the best exercise, because that's the two exercises I do. Qigong exercise, if you want to know where Qigong class is happening, I teach free Qigong classes on Tuesday, 8 a.m. at the Cambridge Center. Tuesday, 8 a.m. at the Cambridge Center, I teach Qigong. So you can come, and then it's fun. It's not too hard, and then you still feel like you did something, and then it's great. It's a great way to start your day. Okay. Temporal headache. Temporal headache is a also it's a chi and heat disturbance of the flow of the chi and then heat. Oops. Chi and then heat. So at the diaphragm, at your diaphragm line, the body's chi movement can be obstructed. So your chi is supposedly constantly circulating, but easily it can stop at the diaphragm. And that can be worse with stress, fatigue at the end of the day. So this type of the headache is usually one-sided, either here or here. accumulation because heat are meant to go up. That's the nature of the heat. Like your Arctic in your house is the warmest room in your house. For the same reason, heat can accumulate in the head, and because the diaphragm, it's nothing goes through the diaphragm because it's stuck. It's just heat didn't go down, descend, and then it just stay there, and it can give you a headache. This can also happen with redness in the eye or some irritation, vexation, impatience, that kind of headache. So for the treatment principle, harmonize the upper body and then the lower body. So here is the separation. Qi and heat accumulated above the diaphragm. And these people often have a weak digestion. That's why there's an imbalance between the diaphragm down and diaphragm up. So the treatment principle is harmonize this part and then this part. So to do this, I need to descend the qi and heat from the upper to down, and acupuncture can help really well. Chinese herbs is probably better than acupuncture. Moxibustion. Also, some massage, some massage will help. There's a really good ointment for this type of headache. Excuse me. So this little ointment that I often recommend to put on the temple when you have a one-side headache, and this is also good. This is a muscle relaxation, so it's really good for the occipital type of the headache. You can give a nice rub on the behind of the neck, and it is very helpful. I sell those here, $5 for tiny little things. It's really, it lasts long. It's great. Okay. So how to avoid, headache may not take too long to resolve, but the root cause may take a few months to get resolved fully. So the qi circulation part may not take so long time to treat, but often the root cause is a weak digestion, so this may take a longer time to treat it. Chinese herb is absolutely needed for this type of headache. This is very common, and then herb works really well. How to avoid this type of headache? So this is, again, the issue is a circulation of the qi and heat. So small exercise, qigong and walk in the forest, or walk anywhere that you have a chance. Anytime there's a stress component, you can automatically add into any activity in the forest. I like forest, so it usually helps me for anything. Also rest. Canadians and Americans have the great philosophy of the work hard, play hard, and there's no rest in between. So you need to rest. Human need to rest. Human are meant to rest. So please rest, and then don't feel bad or don't feel lazy about taking a rest. It is a self-care. Because stress is a big part of this type of headache, meditation works. Meditation, you can do guided meditations through YouTube, or you can do chanting if you know chanting. I like chanting. You can do you can do good meditation from the YouTube. Okay, any question?